So, our first project presenter is Sam Butler. He is the Executive Director of Doing Development Differently in Detroit, otherwise known as D4. He is also one of our 2020 Innovation Fellows. D4 was founded in 2010 and is a diverse coalition of labor and community organizations committed to equitable development and using the built environment to create win-win scenarios for the community, the economy, workers, and the environment. Prior to D4, Sam was Director of Planning and Technical Programs at Michigan Community Resources and served as Interim Executive Director of Creekside CDC. Sam's fellowship was focused on how his team can infuse more community benefits into Detroit development practice and mobilize various stakeholders toward an equitable development agenda. While there are multiple facets to the agenda, encouraging equity in hiring and training is a cornerstone of the work. Today's talk will focus on how community benefits can encourage greater economic stability through innovating local hiring and place-based workforce development practices. Are you ready to present your work, Sam?
Yeah.
Great.
Me see if I can do this. Hi, everyone. Nice to see you. Let me share this. Great. Can everyone see the screen? Jen, can you see it?
I can. Thank you.
Perfect. Great. Good morning, everyone. My name is Sam Butler, and I'm with Doing Development Differently in Metro Detroit. Today, we're going to talk about workers and community benefits. So at the end of the talk today, I want you to be convinced that incorporating some sort of local hiring or job consideration into a community benefit centered on a large-scale development or even a small to medium large-scale development is a really good idea. So let's dive in. First, an obligatory slide about who D4 is. We are a coalition that was formed in 2010, and we have 4 main constituencies. We work to mobilize community activists and community groups, organize labor, faith-based institutions, and environmental justice advocates. So those 4 constituencies all came together in 2010 and said, we need to figure out a way to use the built environment and the development process to further social and economic equity. It was based on some models happening in New York and California, really around the time when the national community benefits movement and the equitable development movement was really taken off. So in our mission, the words fostering win-win scenarios are actually in our mission. And so we see our work as really trying to foster any solutions that work to help the community, workers, the economy, and the environment. And we do this through 3 types of programs. We do it through direct technical assistance to community groups that are seeing a large-scale development. So we help them out with a community benefits campaign. We'll be talking a lot more about that later on. We do it through civic leadership and training. We want an informed citizenry, and we want local residents to be able to speak for themselves about the developments that affect their own backyards and neighborhoods. And then we do it through a lot of policy research and advocacy. So one of our biggest wins in recent years was we had done a lot of research on an inclusionary zoning ordinance, like an inclusionary housing ordinance that would guarantee a level of affordability in publicly funded projects. And we were happy that was passed by the city. So real quick, what are community benefits? In our view, it's a way for a development to really pursue larger social or economic aims. Some examples might include providing additional affordability or deeper affordability if there's any residential units associated with the project. It could be encouraging local, small, or entrepreneurs of color in the commercial retail space. It could be hiring local residents or other disadvantaged populations and protected classes, such as low-income individuals or returning citizens. We're going to be talking a lot about that one today. It could also be utilizing building techniques to promote greater sustainability, or just providing more space for community arts, recreation, or general public use. So the picture that you see in front of you, that is a refurbished basketball court that was the result of a community benefits agreement that the Pistons actually signed when they opened up their new practice facility. So they agreed to help refurbish 60 basketball courts across the city of Detroit. So these community benefits range from, you know, really large scale things to sometimes something as small and simple as a new basketball court. Our fellowship through REI focuses on mobilizing a variety of actors and stakeholders toward an equitable development agenda. So a lot of these actors include community groups, environmental justice groups, as well as construction unions, so skilled trades unions, and service unions. So when I say service unions, I'm mostly referring to you know, the unions that will represent the security guards or janitorial staff or cashiers. So we're hoping to mobilize all of those various stakeholders toward a shared action plan. And actually last year we were able to form an action plan and get that passed by the members of the group. And there's a variety of projects in that action plan, including, you know, ways to encourage more affordability, ways to encourage just more transparency in the development process. But a lot of the action plan and a lot of the overlap between the various perspectives that these constituents bring is centered on worker well-being and targeted local hiring. So I think local hiring especially is something that we all can get around, because that is something that helps the community. They recognize that their, you know, neighbors and family are going to be the ones being hired. The service unions recognize that for the most part, those jobs might become likely members of their unions. Government stakeholders love it, of course, because, you know, they want to increase jobs in their community. And then the skilled trades, the construction unions really like it because, of course, this is something that won't necessarily inhibit the construction itself, right? It is just another value add onto this. So I want to pivot slightly and just say that, you know, as we've been talking about local target hiring, we have been having a lot of conversations around how this can promote what we're calling place-based workforce development. So what do I mean by that? Hold on. So place-based workforce development is a term that we use, and we think that it is a way to amplify existing workforce development initiatives utilizing local assets. So in many of the cities and communities that you all work in, there probably are existing workforce development agencies, right? Be it a Michigan Works affiliate or, you know, some other city initiative. How can we partner with those organizations to get greater awareness about their trainings into the local community, utilizing, let's say, local businesses, churches, other local nonprofits? How do we really strengthen that network to make sure that everybody is aware of the various resources that are already out there? So the map here, this is an area in Detroit. It's a little west of New Center, if you're familiar with the city. And the residents in this area refer to themselves as the West End. So they call themselves the West End Detroit neighborhood. And this is also the home of Henry Ford Hospital, one of the largest employers in the city and the 6th largest employer in the Metro Detroit area. These pins that I've identified, these are all local community assets that we identified that could help this place-based approach to workforce development. So these are all churches or local union halls or local businesses that have a stake in making sure that local residents get employed. I'll be talking a lot more about the West End and Henry Ford later on. So this concept of a place-based workforce development, it's not new. It's been utilized in a lot of different cities. And it can take different forms and shapes, but there's a common thread between all of them. Most of these types of programs see a combination of community partnerships and co-hosted events. How do we get a training to be hosted in the basement of a local church? They often entail some sort of community-centered and culturally competent entry point. So this sometimes is a physical location where residents feel comfortable being able to walk in and get information about, be it job training or perhaps a referral to social services if needed. I like to tell the story that back in the heyday of the big three here in Detroit, I've heard stories about how, local residents, they just knew that if you wanted a job with Ford, you went to this church. And if you wanted a job with GM, you went to this church that was across the street, right? Like that network, that connection between major employers and sort of on the ground assets was very strong. And so that is really what we're trying to recreate here. So let's get into some national examples, because like I said, this has been done in other places. And so as I'm talking through these examples, you're going to notice a lot of recurring themes. One of the first is the Oakland Army Base. So this was an old decommissioned Army base in Oakland, California that was being turned into a global trade and distribution center and bringing 2,000 jobs. So they signed a community benefits agreement in 2012. And as a result of that agreement, they established a local job resource center. And this job resource center had, it acted as a screen and filter for local residents. And the employer exclusively had to look at applicants from this job resource center for a 5-day period. So local residents were able to find out about the jobs through this center, get some training, and then their applications were reviewed first. We like to call this a first review provision. But not only was there provisions for local hiring in the surrounding neighborhood, but then there was also prioritization given to a whole slew of different disadvantaged workers that included single parents, veterans, returning citizens, local residents that were unemployed for the past 6 months, or young adults that were leaving foster care. So there were some really cool things that they achieved here, and a very deliberate effort to make sure that they would create equity in the hiring. And then there also was a provision for living wages, providing living wages to the workers. Next, I want to bring up the Milwaukee Bucks Stadium. So this was an agreement that was signed in 2016. And again, in the agreement, it stipulated a first source hiring program. So this first source hiring program was a collaboration between the Milwaukee Bucks, the existing city agencies, as well as as well as community organizations. And they identified what they called a local hiring hall. So a community group took, the lead in creating this local hiring hall that recruited and screened applicants. There was a 50% goal set where 50% of the employees working in the Bucks Stadium would come from targeted low-income census tracts in the surrounding neighborhoods. And then as this has been getting off the ground, the agreement also stipulates that there will be quarterly meetings with the employer. So not only did they create this agreement up front, but they also recognize that there needs to be this feedback loop, right? We need to make sure that what we're doing is working, and always talking about how do we improve the efficacy of the initiative. Again, there was a wage floor established. It stipulated $15 an hour by 2023 for all of the employees. And then interestingly, there was also a labor peace provision in the agreement. So basically all that means is that if the employees wanted to organize a union, the employer wouldn't stop those efforts. You know, that wouldn't do any type of union busting or you know, there wouldn't be any disparagement, you know, something like that. And then the last national example that I want to kind of put in front of you is the most recent. This is the Nashville Soccer Stadium that was signed in 2018. Once again, there was a first source hiring program established, and that was set up with a local nonprofit. And the agreement stipulates that the developer has to look at qualified local applicants first that are provided through the first source hiring program. This agreement went a step further than the previous two because the developer even provided some of the money to hire a program coordinator. And so that program coordinator is housed within a nonprofit called Stand Up Nashville, which was one of the main organizers for the CBA. And then Stand Up Nashville works with 6 local community groups that are also named specifically in the agreement to additionally recruit and refer residents. So those 6 community groups are specific churches, you know, there's a neighborhood association. And so, I mean, I think this agreement does a really good job of making sure that that chain, that link between the employer, the intermediary nonprofit, and then the like smaller local nonprofits on the ground, that link is strong all the way up and down. What's also really great about this agreement is that there was a square footage set aside for childcare and small businesses within the development. So employees can drop off their kids at their workplace and be confident that they're being taken care of all day. There was some housing associated with this development, and so there's a provision for affordable housing, as well as a wage floor of $15.50 an hour. So, you know, now that we looked at some of the national examples, I think it's a good moment to kind of identify what are we hoping to address with these place-based workforce development initiatives, right? Like what is the problem that we're hoping to solve? So I think one of the first things that this can help address is a concern that maybe the large development isn't necessarily helping the local residents who are most directly impacted by the development. As I'm sure you all are aware, especially with large projects, you know, the residents who will be living across the street, you know, they have to deal with increased traffic, sometimes increased noise or light pollution. And politically, there sometimes could be a narrative that, you know, they themselves aren't getting anything. And so here's where, you know, a place-based approach to hiring can make sure that we're giving back to those residents who have to incur, you know, the burden of whatever negative externalities are, you know, a resultant from the development. Most importantly, though, I think, you know, what these place-based workforce development initiatives can do is that they can address an essential mismatch between unemployment and job centers. So the graph that you're looking at here, this is a graph comparing some unemployment and labor participation rates between Detroit and the West End. So as you recall, the West End is that neighborhood where Henry Ford Hospital is located. And as you can see, the West End has a higher unemployment rate than the city, a lower labor participation rate. So not only are West Enders more unemployed, but there's also just fewer of them looking for jobs actively. And then this disparity is only further increased when you look at Black or African American labor participation rates. So especially people of color are feeling as though, you know, this job market isn't working for them. And so I think, really creating these community connections between employers and, some local assets and institutions can help address this barrier. I should also point out that, oftentimes a large scale development, especially if it's an industrial development, they're often in the low income areas of color, low income communities of color in a city, right? So, we so often in our development patterns make sure like we dump all of the most negative externalities onto the communities with the fewest resources to be able to handle them. And so as a result of that, there are many other barriers to employment that these communities face that we're also hoping to address. So let's talk about some of those barriers. So based on our research at D4 and a series of focus groups that we hosted across the city over a 2-year period, we found that many low-income Detroiters aren't aware of existing workforce development programs, right? Here in Detroit, we have Detroit at Work, Michigan Works programs, a variety of other workforce development initiatives. So it's not that necessarily these programs don't exist, it's that many low-income communities and low-income residents aren't aware that they exist. So to me, this really points to a last mile problem, right? How do we make sure that these residents are aware that these training initiatives are available to them? We also found, though, that even if you are able to make a low-income resident aware of some of these opportunities, there sometimes is a trust barrier. So, if we're asking a low-income resident to walk into, an office building that they've never been in before, and they're talking to a stranger, and that stranger, is asking for a lot of intimate details about their prior education or family income and things like that. Sometimes, that can make people feel very uncomfortable. And we found that, some people just don't take that next step, right? They might take, the first step, which is a big one. The first step is always the biggest. They might take the first step of walking into one of these training and resource centers, but they maybe not, they won't follow up for the second. So there's a trust issue here that we have to address. Transportation remains a major barrier for low-income families. So in Detroit, 1/4 of our households don't have access to a personal vehicle. This creates problems, especially given the fact that most Detroiters with a job have to leave the city limits for their jobs. So they're going out to the outer burbs. But this also creates a barrier in getting to the training facility itself. So if we can bring the training closer to home, we're confident that we can increase the participation rate and get more people actively involved in some of these workforce development initiatives. I also want to point out that the digital divide is a very real thing. So many low-income families have limited access to home computers or the internet, which, as you can imagine, makes it difficult to research a job opportunity, find out about a job opportunity. It makes it difficult to fill out an application online, as more and more employers are asking applicants to do that. The graph that you're seeing in front of you, this is internet subscription rates in Detroit and the West End. And as you can see, 58% of households in the West End don't have an internet subscription. We found that about 50% of the households have a smartphone. So, that becomes the main avenue through which people access the internet is a smartphone. But still, filling out a job application via smartphone is a really tough task. And there still is a very large percentage of households that don't have any internet access whatsoever. So again, this is what we're really hoping to address by fostering these one-on-one personal interactions. So I've been talking a lot about the West End. I think it might be helpful if we kind of dive in and I can give you more detail about some of our recent efforts to pilot, a lot of these place-based workforce programs that I'm talking about. So we have been providing a lot of support to the West Grand Boulevard Collaborative, WGBC, and it's an all-volunteer organization serving the West End. I can't stress that enough, all volunteer. So it's amazing to hear what they've accomplished without any paid staff. The West End, I know I showed you the map earlier, but just to kind of, put some images to it. This is Henry Ford Hospital. This is the main campus that is on Grand Boulevard right there. This is also the neighborhood where there's the Motown Museum, if you're familiar with that. So this is a neighborhood that historically is it was one of the earliest enclaves of Black middle-class families in the city of Detroit. And so there's major strength, but it's also seen a lot of deterioration as the years have gone by. One of the oldest family-owned businesses is James Cole Funeral Home, which has been family-owned for over 100 years. It's a prime example of one of the pillars of this Black middle class that was in this neighborhood. And more recently, I don't know if any of you saw the headlines, but there was a headline about a woman who was pronounced dead by emergency responders and then brought to the funeral home. And the funeral home actually realized that she was still alive and called in emergency medical treatment. That funeral home that you may have seen in the national news, it made national news, was James Cole right here. The West End, to give you more just context and background, there's about 13,000 residents in the West End, and that represents 2% of the population in the city. The median household income is $19,000, well, $19,700. Across the city of Detroit, it's $26,000. So not only is Detroit low income as a whole, the West End is lower income. And then the West End also is a higher percentage Black or African American. 92% of the population is Black or African American compared to 80% in the city. So the WGBC pipeline, it was established in 2014 as a result of an agreement that was signed between Henry Ford Hospital and Cardinal Health, as Cardinal Health was building a new medical warehouse facility. And so in that agreement, it stipulated that it would work with the WGBC to consider referrals of local job applicants. There wasn't a first source hiring agreement. So Cardinal Health was able to look at all applicants from everywhere in the world at the same time, but at least they recognized that there was a particular pipeline of referrals and applicants coming from the local community. The agreement in 2014 did stipulate, however, that they would partner to co-host some workshops and trainings. So these really took off starting around 2016. And to give you an idea of their frequency, about 15 workshops were held between 2016 and 2018. So 15 workshops in a 2-year period. These workshops, they mostly focus on fundamental employment skills. So things like resume writing, job interview tips, things like that. But then also importantly, it gave residents a chance to talk to a Henry Ford hiring manager who could give a brief overview of the application for Henry Ford Hospital jobs. The Henry Ford Hospital application, it can be daunting, right? It can take as long as 2 hours to fill out. There's a timed test for some of the jobs. So giving residents sort of like an idea of what's entailed and preparing them for that application itself was a big value add, in my opinion. And then the jobs pipeline, since it was established, it is putting together an ever-growing list of partner organizations. And so these partners sometimes include the Michigan Department of Corrections. It can include the Detroit Area Agency on Aging, as well as some social service providers. So there's 2 substance abuse service providers on the boulevard in the neighborhood. And so, you know, the WGBC is working with these partners to not only get applicants referred from these partners, but if they find an applicant that somehow needs access to more social services, they can also refer that applicant to some of the service providers within the network. So in this WGBC pipeline, there's really 3 components that I've just covered, right? There's co-hosted trainings, there's co-hosted job fairs, which I'll get to, and then there's this referral network. A little bit more about the WGBC pipeline. The relationship between WGBC and Henry Ford was reaffirmed and expanded in an agreement around the new cancer center that was being built. And that agreement was signed in 2019. And so not only did that reaffirm a commitment to look at job applicants from the pipeline, it also created greater processes to track applicants that come through the pipeline. So if you were to apply for a job through Henry Ford, there's a drop-down menu that you can click on that will actually say, I am a referral from the WGBC pipeline. There's a renewed commitment to host workshops as well as job fairs. And so I really want to talk about one of a job fair that we hosted in July of last year, because to me, I think this job fair offers a great proof of concept of what we're talking about. So we worked with the hospital to set this date for a job fair. They were able to bring in a variety of their hiring managers across a variety of their various departments, right? So food service, general maintenance, environmental services, you know, even their valets, they hire a lot of valets. And the WGBC marketed the event. They went door to door, flyering it. They put flyers in at local businesses and things like this. And as a result of their efforts, almost 300 people attended the event. I can tell you, before that, we were like anticipating maybe 100 people. Like our target was 100. If the job fair, you know, saw 75 people, we were ready to consider that a win. But almost 300 people came. And during that event, which you can see here, it offered an ability for residents to talk directly to some of these hiring managers. They came prepared with their resume. As a result of that event, 97 people were offered a job. So we were thrilled, right? We think that is a real win, and just kind of proves what can happen when community groups and the large employer, you know, work together. So also last year, we worked with a paid consultant to kind of study the existing jobs pipeline and to come up with some recommendations about how to increase its effectiveness. And the number one recommendation from that study was that it needs a dedicated paid coordinator, right? We talked about it a lot, and we came to calling this position a jobs navigator. So we see this jobs navigator as someone who can not only help coordinate the workshops and the trainings, but then also be available to applicants through the pipeline to get some one-on-one assistance. We at D4 are currently trying to fundraise for that position. Yeah, so if anybody on the call really, you know, has a bucket of money that they want to use to fund a jobs navigator, please see me afterwards. Please let me know. And then last but not least, I will just say that, you know, the agreement around the new cancer center was great. And we are talking with the hospital again as they're opening up a new laundry facility in the neighborhood. So the laundry facility is going to be a partnership between Henry Ford Health Systems, Michigan Medicine, as in U of M, as well as St. Joseph Hospital. And it's doing laundry for all those hospital systems. And so we want to make sure that, you know, local residents, again, are connected to the jobs that are going to be there. So they're anticipating like 100 jobs, but they do see it ramping up in the future. So if you were thinking about, you know, putting together some sort of place-based workforce development initiative in your own city, in your own community, what are some challenges that you might come against? Or, you know, what are some considerations that you should think about as you're putting this together? And shocking no one, I think the big thing that you have to think about is employer cooperation, right? This only works if the employer is interested in cooperating and sees value out of this. So the picture here is, it's actually the Coliseum from the Michigan State Fairgrounds. You may have read in the newspaper that the fairgrounds are being sold to a developer, and that a new Amazon distribution center is going to be on this location. So we're working with the city and the developer and talking to them, trying to get them to sign a community benefits agreement. And we've asked about this first source hiring, and we've been told that Amazon just flatly rejects the idea. They don't want to do any type of first source hiring because they see that as inhibiting you know, their ability to just move quickly in their hiring process. So one of the things that we're hoping to come back at them with is, you know, can there be perhaps a difference in the initial hiring phase versus the ongoing hiring? And here Oakland provides a model. So in the Oakland Army base agreement that I showed you earlier, it separates the initial hiring phase and then the ongoing hiring after the thing is built and up and running. So that 5-day exclusivity period, that's for the ongoing hiring. The initial hiring is actually more geared toward the community because during the initial hiring phase, they will only look at job applicants from the local resource center. So yeah, as you're thinking about your own community, you know, maybe there's an opportunity to kind of separate that timeline in the hiring phases. I think it's also really important to think about the community capacity to coordinate a lot of these efforts. And here's where, you know, Nashville's ability to fund that person really gives them a leg up in making a lot of this happen. I think it's also really important for us to keep in mind that in many of these agreements, you know, the jobs that these pertain to, frankly, are entry-level jobs, right? I mean, it's a lot of janitorial staff, it's cashiers, it's ushers, it's you know, groundskeeper and grounds crew type jobs. There needs to be something that provides a pipeline for people getting entry-level jobs to get onto the career ladder so they can get greater skills. Some of the agreements that I showed earlier, you know, they all mentioned an access to greater training. In our work with Henry Ford has a GED program that it offers to its employees. And so we stipulated in the agreement that, you know, workers through the pipeline will also have access to that GED program. And we're trying to get the same thing for the laundry facility workers. So the laundry facility technically is a different entity, but we want to make sure that those laundry workers still have access to the Henry Ford GED program. It's also, you know, good to bear in mind that the Oakland Army-based deal, which is seen as a national leader in terms of, you know, equitable hiring, it still stipulates that that only applies to non-management jobs. So again, I mean, this is something that we need to think about as we're talking to employers and as we're thinking about equitable hiring. You know, how much are we pushing for the equity in management versus non-management jobs? But no matter what sort of deal is struck between the employer and the community and the city agencies involved, regular meetings and feedback are going to be essential. So all of the examples that I've talked about today, Oakland, Nashville, Milwaukee, even Henry Ford, they're all provisions for some sort of regular communication, because as we get into this, you know, you're going to learn new things and learn ways to make it more productive. So we have to be able to adapt. And then I have, oops, I got one more slide. So I just wanted to end with sort of like a vision for what, you know, an involved place-based workforce development initiative might look like. And, you know, we've been calling it a hiring hall. You've seen that word in some of the previous slides. And so, you know, if we are going to have this sort of local hiring hall program, you know, ideally, I think it would be an agreement where the developer and employer agrees to a certain percentage of local workers. Like in Milwaukee, for instance, they agreed to 50% of their employees would come from local targeted zip codes. I think that's a real hard sell. If you can get an employer to agree to that, that is amazing. But I think if not that, then at least a commitment to first review is still a great step, right? Because all it's saying is that the employer will look at these local applicants first. If they deem for some reason that there aren't enough qualified applicants from this local pool, then sure, they can, you know, blast out the job posting to the rest of the world. But at least local residents get that first crack. And so this local hiring hall, you know, I think ideally is both a virtual and a physical location. You know, is there an online portal, and can there be a physical place where residents can go to find out more? I think ideally there would be a dedicated program coordinator, a jobs navigator as we call it here, who's building these on the ground relationships and utilizing those relationships with community leaders and institutions like churches, local small businesses, to raise awareness about job opportunities, and sometimes even hosting trainings within that church basement, or, you know, maybe it's in, you know, the local restaurant or something like that, right? Like it's places where residents already know and they already feel comfortable. And then if you are able to have a staffed person or even a collection of staff, can they be providing individual attention to some of the local residents and acting as that sort of troubleshooter, right? Filling in those gaps and doing some hand-holding to make sure that they can get hired, but then also following up maybe 6 months to a year afterwards, talking about how you know, the person is doing, and to make sure that we are retaining employment, as well as raising awareness around how they can train for new skills. Again, it's really important to create that jobs ladder. I think there needs to be, you know, a trilateral partnership between the community, government, and the large employer. And these trainings really should be cognizant of both the local skill levels and educational attainment levels, as well as some of the employer needs. And this is where I would argue we can bring value to the local employer, right? That we are creating a customized workforce development program that is tailored to their needs. And then, as I've mentioned, you know, there needs to be a regular convening of partners. I think with all of this stuff, communication is key. And so with that, guys, I know it's almost 10 o'clock and my time is up, but I just wanted to say thank you for listening to me. If you have any questions, I know we're going to do a short Q&A right now, but yeah, please feel free to take down my email or phone number and reach out to me after the fact if needed.